Chronic pain. Are you a sufferer? Chronic pain by itself is not a defined medical condition. Rather, it's a symptom that something in your body has gone wrong. Pain usually stems from inflammation of the body's tissues, and you, the patient, are acutely aware of it. The underlying cause of inflammation is the overproduction of bad eicosanoids and poor insulin control. About 90% of the overproduction of bad eicosanoids and 10% of poor insulin control is responsible for the pain that you feel. An easy way to understand what a bad eicosanoid is it's basically like a hormone that begins to destroy and degrade your tissue. In the medical prescription model, corticosteroids are the most effective prescription for pain relief. And corticosteroids, they are effective. They knock out all eicosanoids, both the good and the bad. But because they knock out the good eicosanoids, which are hormones needed for regeneration and regrowth of your tissues, corticosteroids can have severe effects on your health, like immune depression, cognitive impairment, and put you on a path towards diabetes. What we need is a balance between the good and the bad eicosanoids. We need bad eicosanoids because we do need them to stave off any infection that might be occurring in our body. And we do need good eicosanoids and an impressive amount of good eicosanoids if we want our tissues to heal and rejuvenate and repair themselves. First and foremost, we need to maintain proper insulin control. And we do that by asking you to follow the recommendations of an anti-inflammatory diet. What we have here is a 28-day meal plan, which is exactly that. It's an anti-inflammatory diet. And here we have for you to follow what to eat for breakfast, lunch, dinner, even snacks, and how much to eat if you're a female or a male. And we've even created an easy to follow grocery list so you know what to get each week for the 4 weeks that you follow the diet. Next, we recommend supplementing the diet with pharmaceutical grade fish oil, long chain omega-3 fatty acids. But how much should you take is a big question. Well, instead of guessing, there's an easy test that you can take to actually know how inflamed you are. So wellness is a measurable result. It's measuring 2 fatty acids in the blood, one of those bad eicosanoids, arachidonic acid, over EPA, which is basically fish oil. That value, when one divided over the other, should be in the range of 1.5 to 3. So wellness is truly measurable. If the value is higher than 3, then we need to consider what to do to reduce that number to get it back to 1.3. One of the things we recommend is following the anti-inflammatory diet and supplementing with fish oil. But what if that value runs higher, like in the teens, like 15 or 19? And by the way, the average North American has a value of 19. Well, then in such cases, you may wish to consider taking more fish oil to really reduce that number to a 1.5 to 3 level. Beyond maintaining proper insulin control with our anti-inflammatory diet and supplementing the diet with pharmaceutical grade fish oil, we recommend chiropractic care in order to address some of those aches and pains that you're having in your body. And in addition, we recommend posture rehabilitation in order to improve the way that you sit, stand, bend, and walk to really gain the most from reducing the pains in your body. If you're interested to learn more about the connection between inflammation and chronic pain and how nutrition can help reduce this pain in you, then come to our free information session called Why It Hurts and the 15-Second Solution. We have this information session at Advanced Wellness Chiropractic the last Wednesday of every month starting at 5:15.